Welcome to our comprehensive review of public health nursing. In this presentation, we will delve deep into the essential concepts and practical applications of public health, guiding you through a detailed exploration of the fundamentals, community assessment, epidemiology, health promotion, screening, and advocacy within the field. Public health basics. Public health encompasses a broad spectrum of activities, all aimed at improving the overall health of communities and populations. The three core public health functions provide a framework for this work. Assessment. Gathering data to understand health issues and needs. Policy development. Crafting and implementing policies to address these issues. Assurance. Ensuring that essential health services and resources are accessible to all. Public health nurses play a vital role in these functions, acting as advocates, educators, and facilitators of care. Vulnerable populations. Identifying and addressing disparities in health outcomes is a fundamental aspect of public health nursing. Vulnerable populations, such as low-income individuals, racial and ethnic minorities, and those with chronic conditions, are often at higher risk for adverse health outcomes. Public health nurses must understand the unique needs and challenges these populations face, and work to reduce health disparities through targeted interventions. Public health nursing ethics. Ethical considerations are paramount in public health practice. Nurses in this field must navigate complex moral dilemmas, upholding ethical principles such as autonomy, respect for individuals' choices, beneficence, doing good for the community, non-maleficence, avoiding harm, and justice, ensuring fairness in resource allocation and care delivery. These principles guide decision-making and ensure ethical conduct in public health nursing. Levels of prevention. Preventive measures in public health can be categorized into three levels, each playing a critical role in the overall health of communities. Primary prevention, focused on preventing health issues before they start. Examples include immunizations and health education. Secondary prevention, involves detecting and managing conditions at an early stage to prevent further progression. Screening programs and early treatment are examples. Tertiary prevention, aims to reduce the impact of ongoing health issues. Rehabilitation and support services fall under this category. Understanding these levels is essential for planning and implementing effective public health interventions. Community assessment and program planning. A comprehensive understanding of community health begins with data collection, including primary data, gathered through surveys, interviews, and observations, and secondary data, existing health records and reports. Public health nurses apply the nursing process, encompassing assessment, diagnosis, planning, implementation, and evaluation, to assess and address community health needs. This process helps in identifying community nursing diagnoses, allowing nurses to tailor interventions to the specific needs of the community. Setting up a program. The development of a public health program is a multifaceted process that includes several critical steps. 1. Needs assessment, identifying the health issues and needs within the community. 2. Goal and objective setting, establishing overarching goals and specific, measurable objectives using the SMART criteria: specific, measurable, achievable, relevant, time-bound. 3. Resource allocation, determining the necessary resources, such as funding, personnel, and materials. 4. Implementation, executing the program and interventions. 5. Evaluation, continuously assessing the program's effectiveness and making adjustments as needed. 5. Understanding the distinction between goals and objectives and using SMART criteria is essential in effective program planning. Designing evaluation. Evaluation is a critical component of program planning, allowing public health nurses to determine the program's effectiveness and impact. It involves both process evaluation, assessing how well the program is implemented, and outcome evaluation, measuring the program's impact on health outcomes. Rigorous evaluation ensures that the program achieves its intended goals and outcomes, leading to evidence-based improvements in community health. Epidemiology. Epidemiology is the study of how diseases spread and affect populations. Key terms include: 1. Incidence, the number of new cases of a disease in a given population during a specific time period. 2. Prevalence, the proportion of individuals in a population with a specific condition at a particular time. 3. Mortality, the number of deaths due to a specific cause in a given population. The bathtub model is a visual representation of these concepts, illustrating how diseases move through a population over time and the dynamic interplay between incidence, prevalence, and mortality. Types of epidemiological research. Epidemiological research encompasses various study types. 1. Descriptive studies. These studies focus on characterizing health issues, such as documenting patterns of disease. 2. Analytical studies. Investigate the causes and associations of health issues, often involving case control or cohort studies. 3. Experimental studies. Evaluate interventions, assessing their effectiveness and impact. Understanding the role of each type of research is essential in identifying, understanding, and addressing public health challenges. EPI triangle versus web of causation. Epidemiologists employ models like the EPI triangle, consisting of the host, agent, and environment, and the web of causation to understand disease causation. These models help identify the factors contributing to health issues and guide the development of interventions that target these causal relationships. Understanding the nuances of these models is crucial for effective public health practice. Health teaching and health promotion. In public health, it's essential to differentiate between risk reduction, minimizing the chance of harm, and harm reduction, reducing the negative consequences of risky behaviors. Health teaching involves providing individuals with information to make informed choices, while patient education empowers them to take control of their health. Public health nurses play a pivotal role in both processes. Social ecological model. The social ecological model is a comprehensive framework that considers how individual behavior is influenced by multiple levels of the environment. These levels include the individual, interpersonal relationships, the community, society, and policy. Public health nurses use this model to develop interventions that simultaneously address health issues at multiple levels, recognizing that individual health is inextricably linked to the broader social and environmental context. Stages of change model. The stages of change model, also known as the trans-theoretical model, recognizes that individuals progress through different stages when making behavior changes. Pre-contemplation. The individual is not considering change. Contemplation. The individual is thinking about change. Preparation. The individual is planning to change. Action. The individual has initiated change. Maintenance. The individual is working to sustain change. Understanding and applying this model helps public health nurses tailor interventions to individuals at various stages of behavior change, optimizing the chances of successful change. Screening and referral. Health screening involves the systematic identification of individuals who are at risk for specific health conditions. Public health nurses play a pivotal role in coordinating and conducting screenings. After identifying individuals at risk, nurses facilitate referrals to appropriate healthcare providers or services. Sensitivity. The ability of the test to correctly identify those with the condition, and specificity. The ability of the test to correctly identify those without the condition, are key measures in evaluating screening tests' accuracy. Social marketing and policy advocacy. Social marketing involves applying marketing principles, often referred to as the 4P seconds: product, the health behavior or change, price, costs and benefits, place, where the intervention will take place, and promotion, communication strategies. These principles are used to promote positive health behaviors and encourage individuals to adopt healthier practices. Public health law is critical in shaping health policy, and nurses have a crucial role in advocating for public health policy changes that benefit the community. Community organizing and advocacy. Public health nurses serve as advocates for the community, striving to create positive change and influence policy to improve public health. Community organizing is a strategy for mobilizing individuals and groups to address local health issues. While it offers the advantage of grassroots engagement and tailored solutions, it also presents challenges such as resource limitations, community resistance, and coordination difficulties. Recognizing both the advantages and challenges is essential in successful community organizing. In conclusion, Our comprehensive review has delved deeply into key concepts in public health nursing, offering a detailed understanding of the field's fundamentals, from ethics and program planning to epidemiology, health promotion, and advocacy. These fundamentals serve as the foundation for effective public health practice, ensuring that nurses can address the health needs of communities comprehensively. Thank you for your active participation and engagement in our exploration of public health nursing's core principles and practice. Your commitment to understanding and applying these concepts is essential in promoting community health and well-being.